Hello, we are the doctors of Little Rock Allergy and Asthma Clinic. We want to discuss with you briefly allergen immunotherapy, also known as allergy shots. It has been estimated that around 60 million people in America are suffering with allergic rhinitis, a condition more commonly known as hay fever, or a breathing condition called asthma. Some people may suffer from serious allergic reactions to insect stings, such as honeybees, wasps, yellow jackets, or fire ants. In order to best treat these conditions, it is essential to know exactly what you're allergic to. This can be done by allergy skin tests or allergy blood tests. Once we know exactly what you're allergic to, it may be possible to avoid exposure to those things. For example, if you're allergic to cats, you may eliminate your allergy symptoms by staying away from cats. However, for most people, it is not possible to completely avoid the things that they are allergic to. For example, you can't avoid tree pollen if you play baseball outdoors in the spring. If you cannot avoid the things that you're allergic to, you may use medications to reduce your symptoms. Good allergy medications, such as antihistamine pills and nasal steroid nose sprays, are now available over the counter without a prescription. These medications may help control the symptoms, but do not make you less allergic to the things that you're allergic to. Even if they are very effective, some people may have to use medications day after day, season after season, and year after year. Allergen immunotherapy, more commonly known as allergy shots, is the only form of treatment that can actually reduce your sensitivity to the things that you are allergic to. It is the closest thing to a cure for your allergies that we currently have available. By becoming less and less allergic over time, in a process we call desensitization, you will have much less allergy symptoms and subsequently a greatly reduced need for medication. Allergy shots are created individually based upon a custom-made mixture of the very things you were found to be allergic to. There are typically 3 or 4 bottles of your custom-made mixture, typically referred to as your extract, with each bottle containing the same ingredients but getting 10 times stronger with each subsequent bottle. We begin your injections or shots with the weakest dose of the weakest bottle. Each time that you come in for a shot, typically every 3 to 7 days, your dose gets stronger according to our dose schedule. Once you get to the top dose of the first bottle, you go to the lowest dose of the second bottle, which is 10 times stronger than the first. You continue this process until you reach the strongest dose of the strongest bottle that your doctor has prescribed. This is called the maintenance dose. When you reach your maintenance dose, you are typically 6,000 times stronger than your original starting dose. Most people choose to get their allergy shots once weekly or every 7 days during the buildup phase. For these people, it will take approximately 6 months to reach their maintenance dose. Some people may choose to get their allergy shots twice weekly, 3 days apart, which will allow them to reach their maintenance dose in approximately 3 months. In order to build to your maintenance dose in a timely way, you must commit to coming for your allergy shots on a consistent basis. Although this doesn't mean you must be perfect, every time you're late or miss a shot, your dosage must be reduced as a safety precaution. Once your strongest dose or maintenance dose is reached, you're not finished with your allergy shots. However, we generally allow you to reduce the frequency of your shots to every 2 weeks. Later in the treatment course, when you reach the maximum effectiveness, your doctor may permit you to reduce the frequency of your shots to every 4 weeks. Although most patients begin to get improvement in their allergy symptoms within the first 3 to 6 months of starting their shots, many will not reach their maximum improvement until their second year. Therefore, it is permissible for patients to continue their usual allergy medications if needed, especially during peak allergy seasons. Although patients may have excellent control of their allergies, studies show that stopping allergy shots too soon may lead to the rapid return of their allergy symptoms. Therefore, we recommend that you continue your shots for 5 years before discussing the pros and cons of continuing versus stopping your shots. Because there is no inherent risk from the shots, besides the small risk of an allergic reaction to the shot itself, some patients may elect to continue their shots beyond 5 years. Although there are many benefits to allergy shots, there are a couple of drawbacks. First, we are injecting into your body the very things that you are allergic to. Therefore, it is possible but rare to have an allergic reaction to your allergy shot itself. The purpose of the slow and progressive build-up protocol is to minimize the risk of a serious allergic reaction. Our statistics, which are similar to other published statistics, show that there is less than a 1 out of 1,000 shot chance of having one of these allergic reactions. These reactions, which we call systemic reactions, can cause symptoms including an outbreak of hives or swelling, itching of the palms and soles, difficulty breathing, lightheadedness due to low blood pressure, stomach upset like you might throw up or have diarrhea, or a sensation that something bad is about to happen. Extremely rare. In less than 1 in 2.5 to 3.5 million cases, this could lead to a near-fatal or deadly reaction. This means that you are statistically 4 to 5 times more likely to be struck by lightning than have a deadly reaction to an allergy shot. For most patients, the significant benefits of allergy shots outweigh the small potential risk. It is because of this small risk of a serious allergic reaction that we have 3 safety requirements to get allergy shots. 1. You must get your shots in a doctor's office or medical facility that has medical personnel, meaning doctors or nurse practitioners who are trained and have the equipment needed to treat a serious allergic reaction should it occur. This means that you cannot take your shots home and give them to yourself, or have a friend or family member give them to you. 2. You must wait 30 minutes in the doctor's office after you receive your shot before you leave. This is based upon statistics that show 85% of all serious reactions start within 30 minutes after the shot. By waiting 30 minutes, you've gotten past the greatest period of risk. If you experience any unexpected or unusual symptoms after your shot, please notify your nurse or doctor immediately. Additionally, we recommend that you not exercise vigorously within 1 hour after your shot. 3. Because there is a very small risk of a reaction to your shot up to 2 hours after your injection and after you've left the doctor's office, we recommend that you have with you injectable epinephrine for each shot visit. This will be prescribed for you and demonstrated before your first injection. Injectable epinephrine should be your immediate treatment of choice for all serious allergic reactions mentioned above, with subsequent immediate evaluation in the emergency department or similar medical facility. In addition to the serious allergic reactions just mentioned, it's very common to have non-serious local swelling, redness, and itching at the site of the allergy injection. This is called a local reaction and is due to the immune reaction that is happening below the skin when the things that you are allergic to are injected. It is not uncommon to have what we call a large local reaction, generally swelling that is greater than 2-inch diameter. These large local reactions are not dangerous but can be uncomfortable and sometimes discouraging if they happen frequently. We advise you to let your allergy nurse or doctor know if you have local reactions that are larger than 2 inches and causing discomfort. There are several strategies that can be used to reduce the frequency or severity of these local reactions, including pre-medicating with antihistamines, using a cold pack at the injection site, or slowing down the progression of doses. Specific issues that we want to make you aware of. First, notify your allergy nurse or doctor if A. you become pregnant. Your doctor will discuss with you options depending where you are in the allergy shot buildup. B. you are on or start new blood pressure medication or eye drops, especially those that end in LOL. Examples are propranolol, metoprolol, timolol, and others. there may be some risk that you won't respond as well to epinephrine should you need it for a systemic reaction. C. You have any systemic or large local reactions after a shot. There may need to be a reduction in dose or other interventions before the next injection. D. You have any symptoms of worsening asthma or breathing problems such as shortness of breath or wheezing. Peak flow testing or further evaluation may be necessary before you get your next injection. E. You have a significant new illness of any kind, particularly with a fever or feeling sick. It may be best to wait a brief period until you are better to get your shot. This does not mean that you can't get a shot if you have a typical cold. The second potential drawback to allergy shots for some people is the time commitment to come in and get their shots. We try to make it as convenient as possible at our own clinics. However, sometimes it may be more convenient for you to get your allergy shots from your local doctor if you live a great distance from one of our clinics. If you get your shots from one of our clinics, we will provide you with a bar-coded plastic card, like a store card, that allows you to scan into our shot computer immediately when you arrive for a shot. This means that you do not need to make an appointment to get a shot. Just show up during our shot room business hours and scan in. When you scan in, your information will be sent to the shot room computer and you will be called in the order that you arrived on a first-come, first-served basis. After you receive your injection, you wait for 30 minutes and then you are free to leave. Additionally, we would encourage you to take advantage of our complimentary cell phone application called Allergy Tracker that can notify you when your shot visits are due and any unexpected closings of the shot clinic. As a part of your routine monitoring during the allergy shot process, your doctor will typically schedule a brief follow-up visit in 3 to 6 months after starting your shots. A more extensive visit, called a checkup visit, will typically be scheduled for 1 year after the start of allergy shots. As a part of this visit, your doctor may perform repeat allergy skin testing to the panels to which you were allergic. This requires you to be off antihistamines for at least 3 days for this visit only. Repeat allergy testing provides objective information about your degree of desensitization, how much smaller your reactions are compared to the original test, to complement your subjective report of your improved allergy symptoms. This information may help your doctor decide if you are at an adequate maintenance dose or may need an adjustment in dose. After the first year's checkup visit, we typically would see you back once a year for what we call review visits. These visits do not usually involve any allergy testing. They serve to keep your doctor informed of your allergy control, medications used, new medical or surgical updates, and whether any changes are needed in your allergy management. If you decide to begin allergy shots, your allergy extract will soon be made for you. If you are getting your shots at one of our clinics, you will receive a call from one of our shot nurses to schedule your first shot. They will remind you of the safety measures that we have just discussed and show you how to use your shot card. If you get your shots at your local doctor's office, your extract will be mailed to the doctor's office or sometimes to your home address when it is ready. If you receive your extract in the mail, please place it in the refrigerator and take it to your doctor's office to begin your shots. Allergy shots are usually covered by most insurance plans, with some exceptions, but may include some copays or deductibles. If you wish to know the exact details of your coverage, you should contact your insurance provider directly. We hope this video has been helpful in explaining the allergy shot process. Your allergy doctor and nursing staff here at Little Rock Allergy and Asthma Clinic are available to answer any questions that you might have. We thank you for your trust and look forward to your improved allergy control.